So shall we start?
Yes, we can start.
Good afternoon, everyone. I'm Dr. Kirti Suta. Welcome to Facebook Live session from Dr. Makkar's Diabetes and Obesity Center. Today, we will be discussing about reversal of diabetes. It's a fact or a myth. Whenever any person suffering from diabetes comes across this word, reversal, reverse your diabetes, bring your HbA1c to normal. Many question arises in their mind. Will I be able to reverse my diabetes? Will I be able to bring my sugar under control? What type of diabetes is reversible? Will I be able to live without medication? Is there any possibility of relapse? And many, many more. So today, it's our attempt to give you a scientific answer to all these questions. And for this session, we have Dr. Makkar with us. Sir, welcome.
Good afternoon. Thank you, Dr. Kirti. Good afternoon, everyone.
So my first question to you today is, what do you mean by reversal of diabetes?
So, in layman language, reversal means that you have you have come back to normal state from diabetic state. So that means you got diabetes, you moved back to normal state, and you don't have diabetes now.
Yes.
But there are a lot of confusing, issues with the word reversal. One feels that you have reversed diabetes, that means you will not get diabetes now. So reversal is not permanent. One, it is actually, technically speaking, it is remission. Reversal means that once we have put you in back in the non-diabetic state, then as long as you are living without diabetes. So it is not technically reversal, it is kind of remission. Reversal also means, reversal basically, if you go to the dictionary meaning, reverse means that you move back. So suppose you have moved to advanced stage of diabetes and you move back and come to a less advanced stage of diabetes, improve your situation, that is also reversal. Reversing means like, you are reversing back your car and you're moving back to a previous point. But reversal in layman language is actually perceived as that you will get rid of diabetes and it will never come again. So technically, there is no such situation that we can guarantee that if you have moved back to non-diabetic state, you will not get diabetes again. So technically, it is remission that with a set of treatment strategies, whether it is medical treatment involving lifestyle interventions, very intensive dietary interventions, and some medications, or it is bariatric surgery, a diabetic patient can go back to a non-diabetic or normal state. But how long will that state be maintained depends on multiple factors. And second thing is, it is not permanent. So technically it is remission, it is not a reversal of diabetes. But we use the word reversal and remission kind of synonymously. So, for general understanding, reversal means that you can go back to normal state, but there is a chance that it will come back.
So there's a difference between cure and reversal.
So we are not talking of cure.
We are talking
Cure
about
means
reversal.
that you are cured of diabetes and you will never get it. Okay. So even the cure word in medical terms is something very, very different. So like we say cancer is cured. So when do we say that cancer is cured? That means you have got treated for the cancer and during the 5 years follow-up, you have not shown any sign of recurrence of the same cancer. But suppose you get the same cancer at 10 years. Do we say that you were cured earlier? So it is usually presumed that the next cancer that happened after a gap of 5 years actually started from a different group of cells in the same organ. It is not the previous cancer cell. If they were there, they will show up in 5 years. So that is how we label cure. But can we label 5 years of remission as cure of diabetes? Again, it's a question because if you see the follow-up data from a lot of bariatric surgery patients, who have been into diabetes remission are getting back diabetes, say, after 10 years or 15 years. So, remission is a better term for general understanding. So, even relapse is used synonymously, but as of now, type 2 diabetes, we don't have a cure.
Great. So can all types of diabetes be reversed?
Again, very good question. And very recently, very famous Baba Ramdev showed some videos talking to young girl type 1 diabetes and हमने ये करा अभी आपका इंसुलिन बंद हो गया and all that, and that led to a lot of reaction from the medical profession and endocrinologists. In fact, we from RSSDI, which is the Research Society for Study of Diabetes in India, and I am in the executive board of that, we drove a special campaign to educate the public that don't get carried away with such kind of advertisements or claims, because type 1 diabetes, you do not have any other treatment except insulin, and there is no cure for type 1 diabetes. And suppose you are banking on that kind of cure, the child can get into a severe hyperglycemia which can be life threatening. So type 1, you should not think of cure. Now, technically speaking, there is a phase in type 1 that after the initial, after the onset of diabetes, once you treat these children, nicely and get their sugars into control, their pancreatic function recovers for a while. And during that period, their insulin requirement goes down to zero. So they become kind of normal children without diabetes, and their sugar remains normal because the pancreatic function, which was suppressed because of high glucose levels, has recovered. But there is a very progressive decline in the pancreatic function, and due course of time, these children get back their sugar. So this is called something called honeymoon phase for type 1 diabetes, which may be thought of by some people or lay persons that no, diabetes disappeared, but actually it is honeymoon phase. During this period also, you have to maintain lifestyle interventions, keep checking their sugars at regular intervals, and be watchful for the signs that diabetes is appearing again. So there, except for type 2 diabetes, we are not talking of remission of diabetes or reversal of diabetes for any other type of diabetes.
Sir, so that means that we have a selected patient range, or we have few criteria on which we can select that this group of patients can be taken for reversal. Otherwise, everybody does not fit into that reversal criteria.
But the good thing is that almost 98% of the diabetes patients have type 2 diabetes. So majority of the patients actually, if they are diagnosed, if they are in early part of disease, are candidates for reversal, and they can attempt reversal. So yes, there are certain criteria which will tell you that this person is more likely to reverse or get into remission as compared to the other person. But almost all type 2 diabetes patients, at least in first 6 to 10 years of diabetes duration, can think of going into remission if they actually go for a proper structured treatment for remission.
So, sir, if I ask you who are the ideal candidates who can be taken or who can be considered for reversal?
So ideal candidates for type 2 diabetes, what we know from studies, is that patients who are overweight and who have a diabetes duration of less than 6 years. That is the study with medical management, which there is a very famous trial called DIRECT trial, which took patients with type 2 diabetes up to 6 years of duration and who were, obese, and they managed them for remission of diabetes. And if you look at the bariatric surgery data, the chances of remission are high if the duration of diabetes is less than 5 years. So again, 5 to 6 year duration of diabetes and overweight and obesity. are good parameters that person can be is a good candidate for remission. But somebody who's already having multiple complications or comorbidities and also has gone on to insulin therapy, the chances of reversal will be less. So any patient with advanced diabetes, less chances of reversal. If you initiate remission therapy as early in the course of disease, the better are the chances of remission.
Big question which arises to one's mind is, "Ki, why should I reverse my diabetes? What will I achieve after reversal of diabetes?" Can you please highlight on this thing?
Yeah, it is important question because first thing is we don't say that you are going to reverse and reversal is permanent. We always say that you are going to have a remission. That remission may last few months to few years, depending on how aggressively you follow the treatment strategy post reversal, post remission. You have gone into remission and you then get back to the haywire lifestyle, you gain back weight, you lose physical activity, everything will come back. What we have to keep in mind is that in type 2 diabetes, there is a strong genetic predisposition also. Most of the patients who have type 2 diabetes have diabetes in their families. One parent or grandparent or both parents or siblings will have diabetes. So there is a genetic predisposition. And then there are environmental factors like, presence of obesity, sedentariness, uh, inappropriate eating behavior, eating habits, uh, junk food eating, and all that, which adds to excess calorie intake as compared to the decreased calorie expenditure. This leads to chronic accumulation of fat in body and leads to obesity. Obesity is the key driver of type 2 diabetes, right? So genetic predisposition is there. So that is something which leads to loss of remission or coming back to the diabetic state. Now, important thing is once we are likely to come back to diabetic state, there is no fun in becoming non-diabetic. But the important thing you have to keep in mind is that a good glucose control has a long-term legacy effect. So if you are attempting remission, that means we are bringing you to normal glucose levels. And you are going to stay with that normal glucose depending on, for a variable period, depending on how much effort you have put in. Or how effective is the treatment. Not exactly how much effort you have put in. Effort has a role, but it does not take care of everything. Because your genetic predisposition is strong, then your effort may also not be working that well. Not every medication will help you the same way which helps the other person. So depending on variable factors, you are likely to get back to diabetes. But the period that you are spending with normal glucose levels is giving a good glycemic memory, good glucose memory in the body. And this good memory of normal glucose levels, as long as you are having, happy time, that means your glucose levels are normal, your health is fine. This is stored in body's memory. Similarly, you have bad time, high glucose levels, high body weight, high blood pressure. This is also getting stored in your body's memory. So something like, you have bad memories of childhood, they will keep troubling you through your life. Similarly, good memories of childhood, you keep remembering them. So body has metabolic memory. The longer is the period with good glucose control, the longer is the good metabolic memory. And this good metabolic memory actually reduces the risk of long-term complications. So individuals who have good glucose control, especially in the first 5 to 10 years of diabetes, their chances of getting complications at 30, 35 years is also reduced. But people who have poor glucose control in first 5 to 10 years, the chances of getting complication increases within 10 years only, and it goes on increasing. After 10 years, even if you get your glucose to good control, your risk of complications will be much higher as compared to those who had good glycemic control in first 10 years. So the good metabolic memory that you achieve with the remission of diabetes or attempt to remission of diabetes actually gives you very good long-term protection from complications or long-term reduction in the risk of complications. So it is very important advantage that one should try, going for remission.
So, sir, can I say that remission should be a goal and not an option in the right candidate?
Absolutely right, but there are caveats. First thing is it is not easy. That is a difficult thing to do. Not everybody can do it. One has to be really motivated, and it is not, a commitment for 3 months or 6 months. Whatever remission we have seen is related to the amount of weight loss and of course the predisposition. Not everybody will, who loses weight will get into remission. Not everybody who does not lose weight will not get into remission. I will show you very interesting, data from study at this point of time. Give me a second. I am sharing my screen. So can you see my screen now?
Yes, sir.
So this is a study which is a direct trial, which was presented at, um, International Diabetes Federation meeting at Abu Dhabi. I was there in this meeting when this data was presented. So what this study, the research group did was they identified patients with type 2 diabetes who were willing to go for remission, and they gave them a very low calorie diets. So they were given formula diet actually, 800 calories and monitored for almost 2 to 3 months. And the remission was defined absence of, the uh, normalization of glucose level in the absence of treatment. That means everything in terms of diabetes treatment was stopped, and these patients were followed on very low calorie diet, and their sugars were monitored. And if they were having normal glucose level for more than 2 months, they were considered into going into remission. Now, in this group, the average body weight in the group was 100 kg. And the people who were subjected to very low calorie diet, 24% of the patients or individuals lost at least 15 kg, that means 15% of body weight. Now, if you look at these 24% of the patients or the overall population, 46% of the patients went into remission. Right? Now, let us look at more data. So, people who lost more than 15 kg or more than 50% body weight, 86% of patients went into remission. So, that means there are still 14% who did not get remission. So, not everybody is going to respond to, even best of the effort. Similarly, those patients who lost 10 to 15 kg, 57% still got into remission. So even in 10% plus weight loss, there are good chances of getting into remission. Now, people who lost between 5 to 10% body weight, 34% also got into remission. So even with more than 10 kg or 10% weight loss, almost half did not get into remission. On the other side, even with less than 10 kg weight loss, 1/3 got into remission. So despite we having very good strategy, we cannot be 100% sure because there are many other determinants. Because we don't know, the duration of diabetes. There will be some patients who had remission with 5 to 10% who had just got diabetes. On the other hand, there will be patients who have got diabetes for 6 years and they have not gotten into remission. Second thing is, in this range, there is weight loss of 5 to 10 kg. So people who are closer to 10 kg will be having higher chances of remission than those who are closer to 5 kg. So there are variables which you have to keep in mind and which will define, whether a person will go into remission or not. But very good chances that if you are on intensive treatment strategy, and you lose 15% body weight, 86% chances of remission are there, right? Now, after this, the bigger question is how you go for sustaining. That becomes a challenge.
So, sir, whether you go into remission or not, you have health benefits and you are always in a win-win situation.
Absolutely. Absolutely. Does not
So what are
matter whether you get into remission or no, you will certainly have better control of diabetes and lesser chance of complication. And also better, quality of life, which is most important.
So what are the strategies which are being used for the reversal?
So currently, we are living in the era of evidence-based medicine. We keep seeing a lot of, now videos, a lot of self-styled reversal specialists and so on. But whatever science and evidence suggests, there is no shortcut to, success. It has to be a structured lifestyle intervention program supported by medications as and when required, which helps you in reducing weight by 10 to 15% over a period of 3 to 4 months, and which needs to be sustained during follow-up, is the only strategy, medical strategy for remission. Or otherwise, very severe or morbidly obese patients who undergo bariatric surgery, there is very good chance of remission of diabetes if they are not kind of beyond 5 to 6 years of diabetes. If they are more than 6 years duration, chances of remission go down.
So, sir, as a healthcare person, our responsibility is to provide the right information to the patient, motivation, and counseling.
Absolutely. And motivation actually is the first and foremost thing. If somebody is not motivated, first you have to tell them everybody has to follow a diet plan. Now, if person is not motivated, first thing is diet, compliance is less. Second thing, we have to tell every single patient to follow a certain amount of basic requirement of exercise which needs to be fulfilled. Once somebody is losing weight and is not exercising, there is more loss of lean or muscle mass, which is not good thing to happen. So to maintain that muscle mass and to maintain that muscle tone, you need to keep exercising. And if you exercise during weight loss process, your chances of losing fat are higher as compared to losing muscle mass. And that is precisely what we want. So during weight loss, person has to exercise regularly. Post weight loss, to sustain that weight loss, person again needs to exercise at least 1 hour every day for rest of his life or her life. Now, if somebody is not, willing to exercise on ongoing basis, even if you make them lose weight during the intensive treatment plan, post treatment plan, if you do not have good follow up or good, strategy for weight maintenance in place, or weight maintenance program in place at your place or setup, then these people are unlikely to, have those benefits sustained for a longer term. And this kills you. This leads to a lot of frustration that you did so much, you got back to diabetes, now you have got back into, you lost, you went back to normal glucose levels, and now you are getting back to diabetes again. And body defense is such, as we have discussed so many times in earlier discussions also, that if somebody loses weight once and regains, body's set point defends itself again, and it tries to take you to a higher body weight level, because now body is tuned for weight loss, it is more geared for weight loss. So once you are getting excess calories, body tries to conserve more calories and store extra calories as compared to the previous time, because body is now tuned or prepared to go for another round of weight loss or starvation. Whenever you are losing weight, you are reducing the calorie intake, body is perceiving this as a threat. So body is prepared for subsequent threat even better whenever you get excess supply of calories. So every time you lose and gain, your gain will be higher and your loss will be lower. So you will keep on climbing up the stair of body weight if you don't sustain your weight. That is most important thing to keep in mind.
So it's a long journey, that means, and it's not an
Yes.
easy journey. And so I think whenever one wants to go for this reversal or one wants to have this option with him, it should be in a very scientific way. One should not go with the false claims which are roaming around everywhere. And it should be under a team of certified nutritionists, doctor, and a physio.
Absolutely. There is no shortcut to success, one. And second thing is, see, there is a part of um, the oath that we take or medical oath that we take. And there is a basic principle of medical management for any disease, which is, the Latin or Egyptian language says primum non nocere. That means first thing is that you should not do any harm to your patient. Whether you can benefit the patient or no doesn't matter, but you should not do any harm. And for that, you have to have a proper evidence-based scientific procedure or scientific strategy involved for implementing weight loss or a remission of diabetes. And when you are putting these patients on very low calorie diets, they become prone to, going into metabolic disturbances, the electrolyte imbalances, they can get into pancreatitis. So many things can happen. Though they are rare, but they need to be watched for. It is not that VLCD is not safe and, if there are so many complications, why should you think of it? First, we don't need it for everybody. We can do with the, low calorie diets also. Second thing, even if it is being used, and it is used in supervision, that is all that is required.
The next important question which comes into the mind of a person who is suffering from diabetes is, after this journey of reversal, will I have to take any medication?
Yes, again, very important question. Before that, there is another question. We recently had a patient who came with obesity, and she pre-diabetes, and she is on now remission process. So her biggest worry was that once she loses weight, will she develop skin folds?
Yes.
So developing skin folds is another big challenge which you have to keep in mind. If somebody is grossly obese, the only thing that can reduce the intensity of developing skin folds or the risk of developing skin folds is the regular exercise. There is no other way, because the skin, once it is overstretched and you lose significant body weight, there is good chance that you will develop skin folds. That becomes a challenge, especially for females or younger girls, who are unmarried and they are obese, they lose weight, they develop skin folds, they want to wear clothing where they are not comfortable now because of the skin folds and other things. Or so all these issues come up. Now, if somebody has lost weight significantly, developed skin folds, immediately going for surgery is also not a good idea, because you don't know the patient behavior. This person may not be following the lifestyle interventions 5 years down the line, and he may be having higher body weight than currently that, where we started from. So then the whole skin folds will disappear once the weight gain is there. And if you do this, resection of those skin folds, then you are leading to massive overstretching of the existing skin. So it is not to be done immediately. And those things are there, but this is a cosmetic problem. The more important advantage is that you have corrected a metabolic disease, which can lead to increased risk of diabetes, blood pressure, heart disease, heart attacks, brain clots, and so many things. So once you have lost weight, you might have got a cosmetic problem, but there is definite benefit in terms of improving the metabolic diseases or cardiovascular risk factors. Now, second part was the how long should you take medication? So technically speaking, in these studies, they have stopped all the medications once they put the patients on remission. Okay. And after the remission, these patients are not on any medication and they are maintaining on the dietary component, a healthy diet and regular walk. And I will show you now data what happens to these patients at 2 years. You know, let me share the screen again. So this is the follow-up data. Sorry. So after the 2 years of follow-up, now if you see here, sorry, out of the patients who had who had gone into remission, the people who had lost more than 15 kg body weight, those who were sustaining that weight loss of more than 15%, 70% of the patients remained in remission at the end of 2 years. Similarly, those who has lost more than 10 kg body weight, from 57%, the number of people achieving remission at 2 years was 60%. So there was small increase in number of people who were maintaining remission. People who lost even less than 5 kg or 10 kg, but more between 5 and 10 kg, again, those people who maintained that weight loss, almost 30% stayed in remission at the end of 2 years. So it is not, that there is going to be a big challenge in maintaining weight and you will not have benefits. You still will have benefits. And important thing is you have to focus on weight, maintenance of weight, and follow a healthy lifestyle. If you are maintaining your body weight, following a healthy lifestyle, good percentage of patients or individuals who have undergone the remission program will maintain their remission. Now, how long, we as of now do not have much data, but I'm sure some research people are looking at this, and we will be getting data sooner or later. But one thing is very clear, that there is no shortcut to lifestyle interventions and a supervised management from a proper medical team, including a diabetes specialist or internist, supported by lab, healthcare people to focus on exercise, diet, regular follow-up. So all these things are going to be important. So you have to have a team in place, and you have to provide a customized, care to these individuals, depending on so many issues. Now it's easy to say we advise everybody, you should walk for 45 minutes or 6 minutes, 60 minutes. Now, this obese individual has already, his joints going for 6. Now, how can you make him walk for 1 hour? Right? So somebody is having depression, and you expect the person with depression to comply to your instruction. It's not possible. So these are some contraindications where you may not be getting results, and you may not, try to put these people on the remission therapy.
True, sir. Sir, any more thing, any extra thing which you would like to convey to the audience?
I think the whole idea of today's discussion is, one, don't carry it away by the false claims of remission or reversal of diabetes using herbals and all that stuff. It does not happen. It's not easy to do, and if you can do it, if you are motivated enough, then you need more motivation to sustain it once you have achieved. And there is nothing which is permanent. Plus point is that even if you don't get into remission, you certainly improve your quality of life, your overall health status, you reduce the risk of complications 5-6 years down the line also, or maybe during next 10 to 15 years also. So every type 2 diabetes patients who is overweight or obese, in fact, we have worked on people with just small degrees of overweight, but clinically they had strong insulin resistance, and we looked at their liver full of fat. There are other parameters suggesting uh, abnormal fat deposition at different organs, and those patients have responded wonderfully despite they have lost only 3 kg or 4 kg, right? So it depends on what kind of patient profile you are looking at. So right selection of the patient and institution of a clear-cut strategy to manage this patient with an eye on, what would be the realistic goal to achieve first and then go to the final goal. That should be the approach for these patients with pre-diabetes or, obese individuals with impaired glucose tolerance. That is my take on it.
Thank you, sir.
If there are any questions, we can take.
So there are questions in today's session, but they are not related to reversal. So
Then
I'll
we
answer
can
them in
skip.
person.
Yeah, there is no point, having individual questions. And I would request everyone, please don't give questions related to your illness or, your glucose levels or your what should you be using. I think this is not the forum where we are answering those questions. And half the time, even if I do, we will be doing more mistakes than doing the right thing, because we are not seeing patient, we are not having details of the patient, not examining them, we are just responding to a question. So such a response should not be a good treatment strategy, unless I know that this is a patient who is with me 30 years and he has already talked to me and having problem, and then I had something, it's easy to do on phone, but not otherwise. Unless we know, we don't want to do it, and we don't want you also to expect anything from like that from this platform. This is purely focused on improving the level of awareness among diabetes and obesity individuals, so that they have a good healthy lifestyle, regular checkups, regular visit to the doctors, maintain a good diet, exercise schedule, and annual investigations to make sure everything is going fine, and having good supervision of their diabetes. So I think these are all the things that are important, and this is where we should be working rather than the individual questions.
And it's just an attempt of ours to provide the right information to all of you.
Yes,
And please don't go by false claims.
absolutely. It's better not to go for those false claims. It's better to stay where you are. Just focus on not gaining more weight. Just focus on reducing your physical inactivity and improving your overall physical activity status. That will help in changing your quality of life.
Thank you everyone for joining us.
Thank you,
you, sir.
everyone, and hope to see you next week again with yet another edition of Facebook Live from our center.
Thank
Thank
you,
you.
sir.